Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. Hello. Hiya, sorry to bother you. I'm looking for Michele.
My name is Michele Bolger and I am the Principal Radiographer for General and Theatre Radiology at the Walton Centre.
Now, I am amazed that I've found an office that I can't hear the clanking of one of the scanners or, the
you
whirring.
Might, because there's one behind us.
Literally by there.
Yeah.
So, Michele, what got you into radiography?
I fell into radiography. Actually did want to pursue a career in sport because of my age such a long time ago. It was 1987 when I was leaving school. Sport wasn't what it is today.
Right.
And so really the only thing that you'd go down the route of would be a PE teacher. And that was very oversubscribed. So my fear was I'd go to university, do this degree, and then, it would be difficult to get a job. So my best friend's mum said, I know what you'd like. She was working as a receptionist in A&E at Ormskirk Hospital and said, you'd make a really good radiographer. To which I was like, well, what's that? Obviously then did some little research into it, and fortunately there was still spaces available on the Liverpool course, which then was a diploma, not a degree. So our diploma was 3 years. And the year after I finished, it became a degree course.
Which is what, that doesn't really change the training that you had, was it?
No.
Just what you get, I guess.
Yeah, in actual fact, the training we got was probably better because it was more clinical. We didn't get holidays like that you would at university. We got 5 weeks holiday a year. We worked basically. We did academic blocks and then we did our clinical blocks, and the clinical outweighed the academic. So probably the content was similar.
Yeah.
Probably preferred that I did it as a diploma than a degree.
Was there any moment when you were there and you were reassured and you were like, yeah, this is actually brilliant, I want to be here?
Day one, basically, I went to have an interview. A clinical tutor from the Royal Liverpool, who was my favourite person for a very long time until he left, he came over and collected me after an interview with the principal of the School of Radiography and took me for a little look and a tour around the department. And as we were walking over to the hospital, I said to him, so what year are you in? Because he looked so young, I thought he was a student. So he became very inspirational for me. Straight away, I just knew I'd love the job because you're so hands-on. It's an active role. Could never have seen myself sitting behind a desk all day. So.
Yeah. And you've been in radiography ever since?
Yep.
So what is it about radiography? What is it about the thing that you do that keeps you interested?
Fundamentally, I like working with people, obviously patients. I feel that I have a good rapport with people from all walks of life. I think I'm good at putting patients at ease, making them very comfortable, quite an outgoing person. So I can basically talk to anybody. I think it is a skill when you work in a hospital, to be honest. I think what's probably made it better for me here at the Walton Centre was that previously to here, I worked at Alder Hay for 14 years.
Gosh.
I've been here for 17, but 14 years with children, you definitely have to build your own way of communicating with them effectively so that you obviously get the job done, so to speak. When I first came here, I used to get teased quite a bit because the amount that I talked to the patients.
I think that's lovely though, isn't it? Because some people are coming in a very extraordinary part of their life. There is a certain amount of vulnerability that patients have when they visit radiology in particular because they're trying to get to the bottom of what's going on with them. So
absolutely. And aside from patient contact, I also like the challenges with technology because they're always changing.
Yeah.
I mean, I've been very lucky here. We do have equipment changes every 10 years, I would say, because we have so much equipment. I mean, in my area in general and theatre, 11 pieces of kit. So because they all get changed over, say, every 10 years, I would say most years we'll be purchasing, learning new technology, which I cascade the training to all the staff that rotate through. And it's been really good the last few years because we've started doing much more complex surgery and theatre for spinal work, really, which has now just actually moved to brains, because we have a piece of kit called the O-arm, which we can use to take images which are used for navigation for spinal surgery, complex spinal surgery, and also for complex brain surgery. The good thing about that is that we're very included as part of the team. We're not just going in with an image intensifier and taking some images, which obviously the surgeons use for their surgery, but we're actually involved in the sort of planning. It's very critical that we get it correct.
Yeah.
I do really enjoy those advancements in technology.
What is your specific role here at the Walton Centre? What do you look after?
So I look after general and theatre radiography. General radiography is an X-ray room where, and for anybody comes for an outpatient clinic, they will be sent along for it could be a chest X-ray, a neck or spine X-ray, their hips maybe, anything really that the consultant that they've seen or the nurse practitioner requires to help in their diagnosis. I also look after theatre. So in theatre, we have 6 machines, which are called image intensifiers. They are used for the surgeons to see what they're doing during surgery, essentially. So if they're putting some metal work maybe in someone's back, literally we will take images, which they see on a screen. We aid the speed of the surgery because obviously they can see what they're doing.
They know where they are.
Yeah, exactly. They're the pieces of equipment. We have mobile X-ray machines which we take around the wards. We have one over at the Sid Watkins Rehabilitation Unit. I would say we go over there most days to take usually chest X-rays on poorly patients. The biggest thing that I do is I train every member of new staff that comes to my area. I like to know that they've had all the information and they're competent to use the equipment properly.
Why is that important?
For me, obviously, I am a little bit OCD. I've always been involved in standardisation, quality assurance. Obviously, I want the staff that come through my area to deliver the best care without any hiccups. Obviously, it involves radiation, so, they've got to be on the ball.
You run a tight ship then?
I do.
So what does a day look like for you?
My day's quite structured in the sense that I start at 8 o'clock and I plan the workload and the theatre workload. We can have as many as 6 theatres running. So we have to do some clerical work to attend the patient so that they're going to appear on a work list in theatre. And then I need to have a look at what image intensifiers, which are the X-ray machines, will be required for which cases are taking place.
Yeah.
Aside from theatre, I'll then need to look at the inpatient workload for the day, the outpatients that we have booked for the day, and we also have a lot of clinics that I know will be taking place on certain days.
Yeah.
Basically, my job is to go through those requests, put a protocol on those requests for the staff, which will tell them what imaging the patient will require. That is because we do have assistant practitioners as well as radiographers. So assistant practitioners can take X-rays. They can do various jobs depending on what we train them to be competent for. And so it just helps with our service if I have put a protocol on all of the X-ray requests so that if other staff are in theatre, they can still proceed with patients' X-rays so that we're very efficient when patients come from outpatients.
It's almost like you're writing the roadmaps for everybody for the day so that they can follow what they need to do.
Yeah, literally, yeah.
Busy then?
That's just the first hour. And then
My goodness.
those processes they continue throughout the day, but then I will be involved in usually the larger complex cases going to theatre. There's usually someone to train on a piece of kit. And then we get quite a lot of very difficult patients. When I say difficult, I don't mean the patients themselves are difficult. I mean the examinations that we need to perform on them are difficult, because we've taken on now the Walton Centre, the whole of the spinal service for the region. So once they've been to an A&E, they will then be transferred to us for care. So every patient in the region who maybe presents and has a fracture of their spine, it's obviously only spine, they will then be referred to us. And you can imagine that the majority of people that fracture themselves are the elderly. So we get a lot of difficult patients in the sense that they're in wheelchairs, they're in collars. So they are challenging for us to get nice, perfect diagnostic imaging.
So it's really quite important then, isn't it, radiography?
Yeah, you know, and I do liaise with like the spinal nurses a lot. There's a complicated patient, I'll look to them for advice, and we might agree, you know, that maybe not to do what's been requested, but what is best for the patient.
Yeah.
But we always try and achieve the very best outcome so that, you know, they do have the best imaging that can be used going forward.
Michele, it's the quick fire round.
Okay.
Okay, brace yourself. Are you ready?
Go on.
What would you be if you weren't a radiographer?
I'd been a teacher, absolutely.
What's your biggest hobby?
Pilates.
Oh.
Hiking.
Favourite song?
Kissed by a Rose. Seal.
Classic. Favourite book?
Let Them. Theory.
Okay. What's that?
To be fair, it's something I've only just started reading. The Let Them theory is basically about you not being bothered about things outside of your control. I have been telling all my colleagues about it. They think it's quite entertaining. But yeah, you know, being a lead, you know, sometimes people can wind you up because maybe they're not behaving as you would expect. And obviously, unless they're doing any harm, I just have to say, let them.
Favourite film?
Oh, The Green Mile. Yeah.
Yeah, it's a great film. Food you love?
Chocolate. And I don't like it out the fridge.
Room temp.
Room temperature.
Melts in the mouth.
Yeah.
Food you hate?
Now that is difficult for me because I will pretty much eat anything.
Same.
I actually can't think of anything, you know.
That's. I think that's quite healthy. What's on your bucket list?
When I retire, I'd like to do some more travelling. I'd love to go to Vietnam, the Philippines.
Beautiful. Who's your hero?
My mum. Yeah, we sadly lost her. It'll be 4 years in March.
Gosh, I'm sorry.
So, but yeah, she was my role model in life.
And finally, something very few people know about you.
Oh, that's a hard one.
Probably that you're quietly fuming that people are doing stuff and you're trying to let them be.
They know.
So what motivates you?
100% it's the patients. I really enjoy interacting with them, pleased to be part of their journey and hopefully them improving. And maybe sometimes patients, their circumstances are a little bit more complex and they're sad. I like to think that I can make a difference to their day and try and brighten them up while they're in the X-ray department.
It just takes one person with the right positive attitude to change somebody's day.
Do get a lot of nice feedback from patients. Yeah. You get a lot of them, they want to give you a hug when they're leaving the X-ray room. It's nice that you kind of feel that warmth with them.
What are the challenges, would you say, around being a radiographer in the NHS at the moment? What are the challenges?
Challenges probably are staffing.
Yeah.
There are times when we can be very stretched. I'd say that's probably the same for all NHS staff. For me, we have days where we are overstretched, but on the whole, we manage. My job is less challenging because the team that I now have are very good. And when I say the team, it's not just, the same staff that come to me every day. The radiographers that we have at the Walton Centre, they rotate through CT, MRI, fluoroscopy, general, theatre. And I've worked really hard to encourage the staff when they are working in my area to give, 100% during their working day, and everybody does work really hard together. So for me, that's really enlightening. I would say probably the hardest things for me are when we have patients that we have in the hospital for a long time and they regularly come and see us. They're usually happy when they come down because we have a bit of banter with them, but they can be in quite a bad way maybe. Yeah. They've had big trauma. It is upsetting at times, but it's nice to be a part of their journey. And then usually we see vast improvement. We've had patients that we've had coming down on a regular basis for sort of 8-9 months, and then you have seen them getting better towards the end.
Even now, after all these years of being a radiographer, you still feel that about patients who are maybe not so well?
Oh, absolutely. Yeah. I think you always put yourself in their shoes. Sometimes it can be a little bit overwhelming, and, you'll fill up and try and battle the tears back. Yeah, it is a challenge, but again, it's almost rewarding as well because you feel like you're helping them.
Where's radiography heading into the future?
There's definitely more radiographers undertaking the degree now.
Great.
I think that it does get quite a lot of exposure, which it didn't. Liverpool University have massively increased their numbers of students they're taking on. I think they've now got something like 70 a year.
Gosh.
So if we go back to when I trained, there was 13. There might even be more on the last September's intake, to be fair.
That's huge though, isn't it?
Huge, yeah.
And then tech, because obviously radiography is a very technology heavy profession.
Things that are constantly evolving, constantly improving. I can really only speak for the equipment that we use, but we do have for our general x-ray room originally the first twin robotic x-ray system that was put in the country. I know that other hospitals do have the same equipment now. It just constantly evolves, really. As I was saying about the machine that we use in theatre for the navigation, you always think you're kind of, what could they possibly bring out next? Surely we've reached everything that we could, and yet there will always be something down the line. MRI is quite innovative, really. The scanners, they made them bigger, so they're all wide bore to accommodate everybody. There is talk of them making them silent because they're very noisy. But
yes, they are.
But radiographers don't think that would be a good idea. I think they need to have some noise level, because otherwise for patients to keep still for 5, 6, 7 minutes maybe, if they didn't know the machine was on,
they might think they can.
Yeah, exactly. Obviously, they do intraoperative procedures in MRI now, which basically saves the surgeon having to wake the patient up, and then having them scanned post-operatively. They go through into the MR scanner and have their scan while they're still asleep. And then if there's, further surgery to be done, it can be done under that same anaesthetic.
Which is fantastic, really. Yeah. I've seen that happen. It's really amazing.
Yeah, it's incredible. They do lots of new procedures as well. So it is constantly changing.
Is there anything that stays with you? Is there anything about your job over the years that you've kept?
So many occasions, really, of appreciation, I would say, of patients. When we got this robotic system in the general x-ray room, there was a patient that was wheelchair bound that had been unable to get a weight bearing, which means sitting or standing image of their spine anywhere. So I was asked if I would be able to try and get some images for the consultant. So brought the patient in and I explained what we needed to do. We opted to try some sitting images, but we do have a special stand with a special seat, and we were able to hoist the patient onto the seat because she had sufficient upper body strength and get these images. That was a poignant time. I just remember thinking, this patient had finally got what they'd wanted for many years.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.